So here's where we're at right now in Vermont. I got a slide here, a Vermont slide that we've been using with Dr. Sterling. Actually, this is a pretty good dashboard for what we're seeing in Vermont. And then I've got one nationally as well. It's just kind of an overview. I thought this would be a good place to start today. So you can see here in Vermont, we've got, this was updated yesterday. It's the most recent data that they had on their website. You can see here we have 816. If we forward here real quick, you can see here Vermont has between 101 and 1,000 cases. You can see that.
If I could interrupt, only you can see what you're talking about.
You're not projecting that.
Oh, is there something wrong with that?
Well, if you're trying to show it to us.
Yeah. I just thought I'd describe it to you. It would make it more.
Oh, that's fine.
No, I'm just kidding. Hold on a second. I took off share. I think that was Greg's suggestion.
No, that.
There you go.
Okay. Okay. Sorry about that. Here's a couple slides here, just the update. So here's where we're at in Vermont right now. I'm gonna put this up in the corner. Give me 1 second. I gotta hide. There we go. That's better. There we go. So in Vermont, we've got 816 cases. Currently hospitalized 24, hospitalized under investigation 25. We have 38 deaths, and we've made a total of almost 13,000 tests, 28 people being monitored. You can see here, though, I think you can see this.
Actually, John, this information's a little bit dated. We hit 40 deaths this morning.
Okay. This is what they had on the website, most recent data on the state website on the dashboard. I don't know why. You can see here, Ivan, in the bottom. It's dated yesterday at 10:30 in the morning.
Yep.
I didn't check this afternoon. I didn't check later this afternoon, though. 37 cases in Bennington, though. We seem to be holding very steady here. If you just go over to Windham County, which I would think that they have a similar population to us number-wise. Brattleboro, their largest town, is a little bit smaller than Bennington. And then Manchester's actually the third largest community in the southern two counties. They have 63 cases. So right now, Southwest Vermont is doing pretty well. You can see here there's a pocket all the way up through here, Northeast Kingdom, and then the, I guess you call it the Upper Valley district here. It's holding pretty steady there, but generally the numbers in Vermont don't look like they're really moving a lot, which is good. And then you can see here, these are nationwide numbers from the CDC. Every place in the U.S., including all of our districts and territories, have COVID-19. We're creeping up to 40,000 deaths right now. You'll remember the first initial estimates were up to 240,000 people dead from this. Right now we're at less than 40, and they've ratcheted back those estimates quite a bit since the I think it was 150 to 240 estimates that they were throwing out. We are at 750,000 cases in the U.S. though. I'm sure we're over that now at this point. This data is from earlier today. And here's the chart that I was talking about, the map. You can see here Vermont, actually in the Northeast, I believe, numbers-wise. So these are actual cases. So this is not per capita. So of course Vermont's going to have a smaller number, but we're in this category right here, 101 to 1,000 cases. Go across the border to New York. Obviously, they've got more than 10,000. Massachusetts, Connecticut, more than 10,000. And then New Hampshire next to us is a little bit more impacted. It looks like they are, I don't know, I'm not very good with colors. Are they the 5,000 to 10,000, or are they the 1,001 to 5,000?
They're 1,000 to 5,000.
Okay, so they're in that second tier just above us, so I guess based on their population, that would probably suggest that they have about the same infection rate because they have a larger population than us, somewhere along there. But northern New England seems to be doing fairly well. Here's the town staff that we talked about. I just updated this slide because Dr. Sterling has agreed to stay on as the point person Last we talked, he hadn't gone down to New York City. They were credentialing people. I don't know his current status. I haven't talked to him today, but he has agreed to stay on as our point person. And so last meeting, we talked a little bit about PPE. PPE, I guess, includes face masks, whether they're surgical KN95s, the gowns and bibs, gloves, face shields. What else would you throw in there, Janet? It's probably most of it, right?
Yeah, that's all of it.
Talking about the need for PPE. Since the last meeting, I think most of you have read the newspaper. We did get a really strong wholesale supply of masks. In the long run, we've purchased about 11,000 surgical masks, and those are going very, very fast. And about 5,000 of the KN95s, the respirators. Those aren't generally as popular for most people. I'll show you where these are going in a second, but we've actually outsourced a lot of those materials. Here's the story actually by the journal, snippets of it. You can see here actually there's two residents in town, Corey Arava, who is a veterinarian and works for a company out of Kansas, and then Steve Kittredge, whose specialty is actually import from China. So these two guys were really critical in getting us this supply of masks. So far we've sold 2,400 of the 11,000 masks at Kilburn's convenience store. We're selling them to them for, actually this says 96 cents each. It's actually 95.5 cents each, which is the cost of the town buying them, including shipping. So far, they have sold 1,840 masks at Kilburn convenience store. So they've got a little over 500 left right now in stock. We have some more for them as well. They are selling them for $1 each. So when you look at that 96 cents, plus the labor that it takes for them to split the masks up, and then if somebody puts it on a debit card, their profit margin is either zero, negative, or maybe a penny at best. They're really doing this as a service to the public. We didn't want to get into the retail business, obviously, but it's a great place to put them, we think. Centrally located in town, essential business, and actually a lot of the people that are out there working right now in essential businesses do stop into Kilburn. So that seems like a good place. And then RK Miles bought some from us today as well, and they're going to start retailing them as well. They bought 1,000 surgical masks. They've asked for another 1,000, and they have 200 KN95s as well. So we have been able to put these actually out into the marketplace, thanks to the two people that got us some masks. Then we've distributed about 3,000 surgical masks and about 1,280 KN95 masks to what we call essential workers. We'll go through what those are, but the first category is, and these ones we provided, we're hoping that their distribution chain catches up with it, but these ones we did provide to them free of cost in order to fill a gap there. So those healthcare organizations that we sent them to are Northshire Rescue Squad, Northshire Medical, which really needed PPE, Northshire Pharmacy, Rite Aid already had some, Manchester Visiting Nurses needed PPE, and the Manchester Medical Center, we had provided them some earlier from our initial stock. Here's the one that you hear us talking a lot about that we've had so far, knock on wood, really good luck at these facilities compared to other areas. Bromley Manor, Equinox Terrace, and Equinox Village all got, they actually got quite a bit of supplies there between all the staff that they have on site and their residents. We're hoping that by distributing those that we'll have little or no outbreaks in those facilities. Those are the areas that you see, whether it's down in New Jersey or up in northern Vermont, you see when it comes into a senior living facility, it can be really devastating. Of course, our own employees, public safety, Manchester Fire Department has enough for every firefighter for at least a couple calls right now, and we have more if they need them. Manchester Police Department has PPE, and then we gave some to Bennington PD, and actually Chief Doucette, we were trading, I guess it was old-fashioned bartering. We gave them some masks, and then he threw in some face shields. There's a visor and then a shield that goes over your face to protect your entire face from any sort of liquids. Our own water and sewer department, of course, in case they need to do house checks or work on a water break at a house or anything like that. Our DPW department is now going to start working again in groups of 2 based on the governor's guidance. So we gave them masks as well. And then you see here, there's a couple public entities in town. I call them schools and daycares. BRSU for their food service folks. Burton asked for a small supply. And then North Shore Day School had some homemade masks, but Dr. Sterling actually recommended that they be distributed manufactured masks because they are more effective. And then here's a whole long list. I'm not going to read it, but basically a long list of food distribution folks in grocery stores, Price Shoppers on there. I know that they're expecting some of their own supplies, but they needed some. The community food cover here at Town Hall, and then everyone from health food stores to convenience stores is on the list as well.